workers. What is in place in Lagos to protect health workers in case Ebola resurfaces? Because this ECOWAS movement of people and products, it might just turn up again. Or what do you think?
Yes, I will agree with you that health workers are especially endangered in this. But again, I would like us to remember that even at the best of times, health workers are always endangered. This is an infectious disease like any other. There is really nothing special about it. All we need to do is go and do the basic infection prevention control. I'll tell you, sometimes people talk about this personal protective equipment. They're good. But the real problem is when you remove them. It is not when you put them on. Because once you get in contact with the patient, you're already contaminated. So in removing them, you need to decontaminate yourself progressively, or else you will get infected. You will touch your hands. And the hands is actually the problem. What you do with the hands later will touch your eyes.
I guess that just sort of like sums up what happened in Texas with that female nurse.
Yes.
So in the cost of removing the protective materials.
Yes. And you realize that we had almost 6-7 weeks of an infective period, and none of our health workers, except the initial health workers at first consultant, who did not know initially what they were dealing with, got infected. And it was about preparation. None of our health workers that went into the treatment center got in before 2 days of dummy preparation. How to put it on, how to put it off, what you need to do. And it was only after they'd gone through that process before they were allowed to get in contact with the patients. So it's basically about infection prevention, control, and preparation. All health workers will always be endangered one way or the other, irrespective of whether it's Ebola or any other illness.
I watched some of the analysis on what happened in America to that nurse in Texas who died recently. And I was wondering, in our case in Nigeria, did we have a situation where that person is decontaminated before even taking off, or did someone help them to take off most of those gears so that they don't contaminate themselves?
They get decontaminated before they're... It's easy. First thing you come out, somebody decontaminates your gloves, decontaminates the cover.
Okay.
So you remove. Decontaminates again, you remove. So you have to do a systematic decontamination at every point of everything you're removing. And that's what saves you.
This is tedious. I mean,
Yes.
doctors
You
really
said
have
it's
to
easy.
pay attention when they're
Yes.
taking off the outfit.
No,
Because it seems like it is stage by
By
stage.
stage,
You can't be in a hurry.
Sorry, you have to. It's a training you have to go through. In fact, in Lagos, I think it was for about 5 days to be trained, and again how to move within that facility too. You enter through one day, you come out through another. You can't come. You can't go.
Can't come in because there is a patient flow that makes sure that once you come in, until you actually come out of that of those wards, you must be totally decontaminated. So it's a process. It's
Okay, Dr. Idris, we made an attempt to get the Chief Medical Director of First Consultant, but unfortunately we couldn't get him to come on this show. Maybe another time he will be able to feature on this program. It will be good to have him. But what has since happened to First Consultant? It will be good to know, what has the state government and the federal government done? Because a lot of people are saying that that institution, that hospital, is one that has saved Nigerians, the kind of grief we could have had. But what has been done to help them?
Well, I will start from even during the crisis itself. You know, to get the index, the Sawyer out, the decontamination process started. You know, the counseling of all the staff that were involved started. before each time they fell ill, they were moved out of that place. He counted everybody in the facility. And having done that, we decontaminated the hospital several times, according to WHO protocol before the facility was certified. But more importantly, with the stigmatization and all, the government felt that we needed to even give the moral support and that kind of thing. And that, if we recollect again, the governor himself and some of us paid a visit to that facility. One, to see what the problem is, to commiserate with him, and to show the people that when we announced that, look, this place is ready for operations. And if you could go there, any other person could come there. It was also an opportunity for us to assess his needs. I mean, it's hard to, part away with a lot of some things. Some of the medical equipment we help to decontaminate and cut away, basically. So the other was to give, apart from the moral support, the financial support. I know that ESCO passed the resolution to support him as a gesture, because we cannot fully compensate him. As a gesture, a 50 million naira, this thing has been approved for him, will be given to him. And again, the other ways are looking into supporting him. That's as far as we're going.
That's Lagos State.
That's Lagos State.
Okay.
I don't know
what is the
arrangement.
Federal government?
I have no idea.
I
don't know what federal government has done or they plan to do.
Okay. All right.
The vaccine that is being developed, that they say is almost ready for testing. What are your thoughts about that? I'm thinking about the speed with which suddenly drugs are being developed for testing for Ebola, because it seemed at the beginning that the rest of the world regarded this as a West African problem. But suddenly we are exporting Ebola. Ebola is in Spain, is in Germany, is in America, and we have drugs for testing.
I agree with you that it's one of those diseases that everybody thought it's a West African problem. The mode of transmission was what gave them a false sense of hope. You have to have direct body contact. The history of Ebola has been such that it usually occurs in rural isolated areas. So it burns itself out. That's what it normally does. In as much as it doesn't have the next person to infect, it dies. But Sawyer, I think, probably changed the perspective that this is Liberia. In between Liberia and Nigeria, you have Ghana, you have Togo, you have Benin. And lo and behold, somebody left Liberia, flew, and came to Nigeria.
No cases in Ghana, no cases in Benin, none in Togo.
So it started changing the perspective that, okay, somebody might do this. And lo and behold, somebody did do it.
Eric Duncan.
So the idea that there has always been this group of scientists that because of scientific, or how do I put it now, curiosity, we always try to produce something for something. But it's just that they never had the financial backup, never had the government support. So what the Western powers are now doing is basically looking for all those people and now ramping up to try and get the vaccines out as fast as possible, because now it has shown them that it is not a disease that they can afford to deal with.
What's the position with ZMapp?
ZMapp, the process of ZMapp is such that it's difficult to really produce. If you could remember, the process starts with the fact that animals were infected. The antibodies that protected against the ones that did not die were harvested, and they were modified to be grown in a tobacco plant.
So you have to look for infected animals.
Yes.
To get your raw material.
So what they basically did then was to identify, like I said, these antibodies, grow them in tobacco, and then now harvest those antibodies and put it in a sort of serum, which they inject. So it takes a lot of processes to be able to do that. But meanwhile, other people have also started other parts of trying to get a vaccine. And I think those are the ones that the World Health Organization is